Hey, this is your boy Bob TV. On this healthcare thing, I've been thinking about the healthcare. I've been thinking about the People's Manifesto and how it has to have something strong concerning putting political pressure on our local leaders to push universal healthcare, and we focus on United States politicians later, because they a bunch of jacklegs taking money and things like that. Corruption haven't gone up to that level in the states like it has in Washington D.C. There is a beltway, so to speak, on each state, which mine is in Albany. But hey, like I said, it haven't reached a proportion where we can't work. Like California, that's a different deal, because they got a super majority of Democrats, and this punk gonna put it on hold. If you would have went through with that thing, man, what kind of victory the people would have? You want to do things that these jackleg Republicans doing. You want to kind of do what Trump is doing. I digress. Let me get to it. I'm reading another article today. Turtle Man, what he's doing. Senate health bill in peril as CBO predicts 22 million more people will be uninsured. The Senate bill to repeal the Affordable Care Act was edging toward collapse on Monday after the nonpartisan Congressional Budget Office, the CBO, said it would increase the number of people without health insurance by 22 million in 2026. Increase it, not lower it, increase it, doubles it. Two Republican senators, Susan Collins of Maine and Rand Paul of Kentucky, said Monday that they would vote against even debating the health care bill. You hear that? The bill is so horrible, so terrible, that Rand Paul, a Republican, what they call a libertarian type Republican, and Susan Collins of Maine said, nah, we're not even going to vote to go over this. Ain't nothing to talk about or debate. This stuff's crap. Kill it. Even Senator Dean Heller, wow. This guy's normally against this about everything, but Dean Heller said, I'm joining them, and I'm hitting that, me too. I would probably oppose taking up the bill on a procedural vote expected as early as Tuesday, meaning a collapse could be imminent. It's worse to pass a bad bill than to pass no bill. That's what Mr. Paul said. It's worse to pass a bad bill than pass no bill at all. Ms. Collins wrote on Twitter on Monday evening that she wanted to work with her colleagues from both parties to fix flaws in the Affordable Care Act. I just want to fix the flaws in what we already have. But the Budget Office reported showed that the Senate bill won't do that. The report left Senator Mitch McConnell, Turtle Man of Kentucky, Turtle. He left the majority leader with an inevitable choice of changing senators' state positions, withdrawing the bill from considering while he renegotiates, or letting it go down to defeat. A remarkable conclusion on the Republican 7-year push to repeal President Barack's signature domestic achievement. And why are they doing it? Because they don't like this black man. Every time I see Mitch McConnell, all I can think about is Clayton Bigsby. White power! But the Budget Office put Republicans in a tenable position. It found the next year 15 million more people would be uninsured compared to the current law. Premiums and out-of-pocket expense could shoot skyward for some low-income people and for people nearing retirement, it said. The legislation would decrease federal deficits by a total of $321 billion over a decade. The Budget Office said Mr. McConnell, the chief author of the bill, wanted the Senate to approve it before the planned recess for the 4th of July, but that looks increasingly doubtful. Misgivings in the Republican conference extended beyond just a few of the most modern and conservative members, and Mr. McConnell can lose only 2 Republicans. At least some of Ms. Collins' concern could be shared by Senators Lisa Murkowski of Alaska and Shelley Moore Capito of West Virginia, whose rural states would face effects similar to those of Maine. If you were on the fence, you were looking at this as a political vote. This CBO score didn't help you, said Senator Lindsey Graham, Republican in South Carolina. So I think it's going to be harder to get 50, not easier. He added, I don't know if you delay it for 6 months, if anything changes. Under the bill, the Budget Office says subsidies to help people buy health insurance would be substantially smaller than under current law. You hear that? The subsidies will be substantially lower, substantially lower than that is under current law. And the deductibles would, in many cases, be higher starting in 2020. Few low-income purchase of the plan. Moreover, the reporter said premium for older people would be much higher. And under the Senate bill, is for a typical 64-year-old with an annual increase of $26,500, the net premium of $26 with a mid-level plan, as the subsidies would average $6,500 compared to with $1,700 on the Affordable Care Act. In other words, the insurance that would normally cost $26,500 will be cut to $6,500, but on Obamacare it would have been $1,700 under Obamacare, and the insurance would cover less of the consumer's medical costs. The report said for a 64-year-old with an annual income of $56,800, the premium of 2026 would average $20,500 a year, or 3 times that amount which was expected on the Affordable Care Act. The Budget Office report was a major setback to Senate Republican leaders, but it was too early to declare a legislative dead, and the turmoils in the health insurance market could still induce Congress to take action this year. Many people thought the House repeal bill was dead after Speaker Paul Ryan pulled it from the floor on March 24, but slightly revised version was narrowed approved by the House 6 weeks later. Senator John Thune of South Dakota, a member of the Republican leadership, suggested that the leaders will probably press forward with the Senate bill. He said that an argument could be made for delaying it if you thought you were going to get a better policy, but that was not the case. This is best we can do to try and satisfy all the different perspectives in our conference, Mr. Thune said, and that they did not think the policies were approved by waiting. It's time to fish or cut the bait. The White House discounted the report, says the Budget Office had consistently proven it cannot accurately predict how health care legislation will impact insurance coverage. Really? So now Donald Trump going to make a statement on this. Really, dude? Just be quiet. The Trump administration said the Senate Republican bill will not cut Medicaid because spending will still grow from year to year. But the Congressional Budget Office said that the bill would reduce projected medical or Medicaid spending by a total of $772 billion in the coming decades, and that number of people covered by Medicaid in 2026 will be 15 million lower than under current law. In 2026, it is said that Medicaid spending would be 26% lower than under current law, and enrollment of the people under 65 would be 16% lower. Beyond 2026, medical enrollment would keep declining compared with what would happen under the current law. The Senate bill will make it much easier for states to obtain waivers, exempting them from certain federal insurance standards like those that require insurance to prove or provide a minimum set of health benefits. The Budget Office said that nearly half of all Americans could be affected by these cutbacks in essential benefits, and that as a result, coverage for maternity care, mental health care, rehabilitation services, and certain very expensive drugs could be at risk. Before the Budget Office released this report, the American Medical Association had announced its opposition to that bill, and the National Governors Association had cautioned the Senate against moving too quickly. The Budget Office finding immediately gave fodders to Democrats who were already selling the bill as cruel. Senator Chuck Schumer, or Chuck the Cuck, whatever you want to call him. I don't like the guy as a politician. I think he's a hack and he's a corporate suck-up. But he said, the Democratic leader, one of the Democratic leaders said Senate Republicans had been saying for weeks that the bill would be improved over the House bill, which President Trump had described as mean. The Budget Office had found that under the House bill, the number of people without health insurance would increase by 23 million by 2026, only slightly more than 22 million projected by the Senate. CBO report today make it clear that this bill is every bit as mean as the House bill, Mr. Schumer said. The CBO report should be the end of the road for Trump care. Republicans would be wise to read it like a giant stop sign, urging them to turn back from this path that would be disastrous for the country, for the middle class of America, and for their party. The criticism was not confined to the Democratic caucus. Mr. Johnson, one of the 5 Senate Republicans, who said last week that they could not support the bill as drafted, told a radio host that the Senate leaders were trying to jam this thing through. He too suggested that he would not vote even to begin debating on the bill. I've had a hard time believing that I will have enough information for me to support a motion to proceed this week, Mr. Johnson said later on Monday. Beyond the number of Americans without insurance, the Senate bill $321 billion in deficit reduction is larger than the $119 billion that the Budget Office found for the bill that passed the House. Earlier Monday afternoon, Senate Republican, in other words, it's more, way more than it was before, and it failed miserably before, and it was less. So it's gotta fail even more now that it's more. Early Monday afternoon, Senate Republican leaders altered their bill to penalize people who go without health insurance by requiring them to wait 6 months before their coverage will begin. What kind of crap is that? Really? What kind of crap is that? You're going to penalize people because they don't want to buy into your crappy program, and then you're going to tell them they can't get no wait for 6 months. In the meantime, anything could happen. A stroke, an aneurysm, a heart attack, people needing help, and you're going to put them through that pressure. You bunch of coward, weak punks, cowards. No guts, no courage. Weak. Bunch of pussies. I'm talking about what's happening right now. A cowardly pussyfoot move. Only a coward would do something like that. Only a coward will require people to wait 6 months before their coverage will begin through a penalty. Insurers will generally be required to impose the waiting period on people who lack coverage for more than about 2 months. So you're going to make me wait. You're going to make me wait. The waiting period was meant to address a notable omission in the Senate bill. The measure would end the Affordable Care Act mandate that most Americans have insurance. But, it's a mandate. It's still a mandate. You're going to penalize those who don't participate. That's still a mandate. And then you're going to throw on top of that a 6-month wait. Is this supposed to make us want to pay for it? No. Really, we're not going to buy into that crap. If you bring the premium down or get rid of the period, we'll participate in it. The insurance would generally be required to impose the waiting period on people who lack coverage for more than about 2 months in the previous year. The waiting period was meant to address a notable omission in the Senate bill. The measure would end the Affordable Care Act mandate that most Americans have health insurance, but also require insurers to accept anyone who applied. The proposal is supposed to prevent people from waiting until they get sick to buy health plans. Insurers need large numbers of healthy people whose premium help defray the cost of care to those who are sick. Under one of the most unpopular provisions of the Affordable Care Act, the government can impose tax penalties on people who go without health care. Republicans have denounced this as government coercion. The repeal bill passed by the House last month has a different kind of incentive. It would impose a 30% surcharge on premiums for people who have gone without insurance. A surcharge. Mr. Trump wrote on Twitter on Monday that Republican senators were working very hard to get there. But we're not going to get any help from the Democrats. You're doggone right. You're not going to get any help from any independents. And I don't think you're going to get any help from most of the real Republicans that live in your district. Not easy. Perhaps just let old care crash, that's what he called it, and burn, Mr. Trump wrote, reiterating his assertion that the Affordable Care Act would be doomed if Congress did not come to the rescue. So will your plan be, Mr. President. So will yours. It's 10 times worse. Now let's go sum this up real quick. This is Healthcare Weekend, and all I'm talking about is healthcare and the People's Manifesto. So the bottom line is Trump is trying to get his bill passed. They claim that they're not going to get rid of Obamacare. They're just going to fix it up a little bit. And then they're going to raise the rates up, and it's just going to keep going up higher and higher as you age. And if you don't decide to participate in the program, we're going to penalize you. We're going to do what Obama did, penalize you. We're still going to give you the insurance, but we're going to penalize you. So we're going to hit you with a penalty. We're still going to expect you to pay the bill, but we're not going to give you coverage for 6 months. Really, dude? How dumb you think people are? Really? You coward, punks, politicians, bunch of bullies. So people already can't afford Obamacare. A lot of people are still uninsured under that. People who don't get a plan already get taxed, but they're not going to be forced to get a health care plan. You're worse than Obamacare. You're worse than Romney Care. This thing sucks. It sucks monkey balls, elephant balls, and any other balls that you could suck. Hey, this is your boy Bob TV with Freedom on Fire and Rob Report. I want to thank you for watching the webcast. Make sure you share these segments all across your social media network. Like and share, subscribe, and maybe I invite a couple other people to do the same thing. You make the difference. I also want to thank you for those who support this channel through Patreon, whether it's 50 cents to $50 million. It goes right back into what we do here. So like the lights that you're looking at right now, that's because of something that you did. So I really appreciate it. I want to thank my man Vegimatic for the Blue Yeti mic, one of the top microphones out right now. He knew I needed the mic, so he blessed me with it. So all of you guys make the difference into this channel growing, and I really want to appreciate you for that. Also, by all means, again, continue to share your comments at the bottom of each video. Just don't get so visceral to the people who may disagree with me or may disagree with you. This calling out name stuff, that's not for this channel. So please try not to call people names, personal names. Now you can call some of the stuff they talk about crap. I say that, but just don't attack people personally. Words really hurt when you start attacking people personally, because these people really believe these things, and you're not gonna take away their belief by calling them names. So please don't do that on this channel. But nevertheless, I appreciate you guys. We're shooting for 2,000 now, so I need your help. So as my pastor would say, reach one, teach one. I mean, let's reach out. You got the information. Make sure you share with other people and try to get them to subscribe to the channel so we can grow and expand. Again, the money, the finances that you give in your Patreon account, it goes into equipment. So I want to thank you for personally helping this endeavor grow. And last but not least, I am going to think about starting a whoop pack soon, trying to learn from Tim Black and my other brothers out there on how to do it. I'm not going to do it right away. I probably won't do it till I hit about 5,000. Then we'll start thinking about something like that, or maybe a little more. But the Patreon account is fine for now. $1, it doesn't matter. I mean, like I said, it'll help grow this channel as much as I can, as much as we can. I'm Bob TV. Freedom on Fire. Rob Report. Peace.